Okay, welcome to welcome to the 13th training and meetings. Here we discuss the process and effective ways of accomplishing face-to-face training at Muhimbili National Hospital from September 13 to September 16. We have about 46 volunteers who are going to be there, and then not all of them will be in Muhimbili, but majority of the healthcare workers will be in Muhimbili, which will be close to 30 plus people from Tanzania who are going to help us with. So I will send the name to Madam Zura, and for you, Ms. Priscilla, to just the name of the people who are going to be to Muhimbili. I know they are working on trying to get the ID badge. On top of that, we are going to have our ID badge from QHSC. So everybody who is coming there will have the ID badge, so you know who is QHSC members. And if you still guys want the badges, that's fine. We can communicate with that. So I'm the president and CEO of Dr. Gaboni QHSC. So this is the quality healthcare solution and consulting. So we are coming as educators and consulting and come and work with you guys. You're not taking part of any of active management of patients. We have a number of doctors, nurses, nursing students, and then non-healthcare workers who will come and help us during the training, because it's going to require a lot of us to do it to make sure we accomplish those 400 plus people. So we have been working quite a bit to try and prepare. We have already offered a number of online training before we get there. We have Help Baby Breathe, almost, I believe they did 4 sessions. And then we have 3 sessions from postpartum hemorrhage. So all those videos have been shared. And if you guys, we can help us to make sure who was coming to see us are able to see those videos before we get there. So when we do the skills check, everybody's at par, and then at least we are talking at the same language. There's still some logistic, as you know, until we get there. So we are still working 11 days, excited, and you're nervous, but we're excited to come and share our skills and knowledge, and then share best practice with our fellow Tanzania, and we can learn a lot from you guys. We have a number of people from Muhimbili, Mwananyamala, Buguruni, and Mana, who have been attending these meetings. So all the education has been shared to make sure it's applicable for people in Tanzania. I'm sure probably have seen some of the stuff through Madam Zura, but if there's any issues, questions, just let me know. We can communicate still more. But I'm grateful that you are here, and I'm going to introduce my team who are going with me to the medical mission. So I'm going to start with Mr. Siakabe.
Everybody's Subuhi. I am Frank KG Siakabe, Vice President of Dr. Gaboni QHSC, and have the shortest introduction in recorded history. Karibu, Priscilla.
Thank you.
Dr. Msambichaka.
Habari za asubuhi. Mimi naitwa Dr. Lillian Msambichaka. I will be part of the facilitators and trainers for the Helping Babies Breathe, and I'm excited to come and join you all.
And Dr. Lillian is also the chairman of the board of directors for Dr. Gaboni QHSC.
Anataka kujishusha. But anyway, so just a little bit before Ms. Priscilla to introduce yourself, Mr. Pranka is also, this is his second time coming to medical mission. We went together last year in Dodoma. And so he's excited, and it's going to be teaching in Swahili also. And then Dr. Msambichaka, this is the first time going to the medical mission, but we have done a few activities before, and she has been the lead for Help Baby Breathe preparation for the training. And so she is had been an instrument to that area. And she's going to be also the lead person, one of the lead person for the Help Baby Breathe, together with Dr. Fabian Guido, who just walked in here. But when he's getting ready, I'm going to let you, Ms. Priscilla, introduce yourself. I know you just say a little bit, just give us some information background. So when we're discussing today, we know what to area to focus. Go ahead.
Yeah, so as I said before, my name's Priscilla Godwin Kinyamagoa. I'm a midwife here at Muhimbili National Hospital and acting head of Department of Maternal and Reproductive Health. And for this coming 21 days, I'm acting as a Director of Nursing and Midwifery Services here at the hospital. It's for Sister Zura Mawona. And I'm really looking forward to seeing you all and participating in a training. And a good thing, I'm a master trainer of helping baby breathe and helping mothers survive of bleeding after birth and eclampsia, so forth. Yeah.
Okay, so where have you been? You should have been in the beginning when you start learning these teachings.
Yeah, I do, but because of these administrative issues,
Yes.
yeah, but I'll participate in the training wherever I got a time. I'll just pop in the class and have a little session.
Okay, perfect.
Amini Mungu, Amini Mungu.
Yeah.
Okay, I'm gonna let Dr. Fabian Ngido just introduce himself and then we can start. Dr. Fabian.
Hey, good morning in US and good afternoon in Tanzania. My name is Fabian Ngido. I'm a pediatrician. I work mainly in the hospital, so for pediatric hospitalists. Yeah, I have a passion in terms of helping babies survive, and that's our goal. So I'm looking forward to join you guys over there.
Thank you very much.
Dr. Fabian.
Yes.
Asante, Bianca.
Okay, so let me share my little agenda here and then we can start moving along. Okay, so the agenda today. So we are going to we always provide a global training update. For the sake of Ms. Priscilla there, I'm just gonna read through quickly so she knows how many sessions we are done. We're gonna give a little brief for last meeting. The 26th was postponed last Friday because there was a conflict of schedule. And then that's why we're doing one today. And then so main agenda is we're just updating the group that all permission letters have been received. And so we are ready to come. And then so today, at least we're focusing on the schedule and the training and just to make sure our colleagues in Tanzania, so they know that they need to be able to review those videos who were taught before, so they have a knowledge background before they're hands-on. Just to give an update of the stereo processing, I know Mr. Nicodemus has conflict of schedule there, but he was able to provide training last Thursday, and he's from Muhimbili to he did stereo processing of NISGs. And then of course, Ms. Priscilla also has an opportunity to give us an update, anything that we need to know schedule-wise. And I know she responded before that the process, of course, is ongoing right now, but we're gonna need to hear if she has anything to add to it. And then just give you guys the dry run to how we believe that the schedule can go. And thank God Ms. Priscilla is here so she can tell us if it's feasible or there's something that we need to adjust so we can make sure we are ready. And then just to inform everybody else, today or tomorrow, I'm going to send you the link for meetings that we are going to meet on the September 12 in the afternoon with all leadership, just to make sure we stay abreast and then to make sure we address the administrative information needs that we need to do before we start the training the next morning. So as I said, we usually review this part, but because Ms. Priscilla is the first time, so I'm just gonna go over quick. So we started training in May 19. We did the neonatal health and neonatal resuscitation. Dr. Msambichaka and Dr. Xavier Banela from Mwananyamala provide those educations. And then we had another training on May 26, neonatal temperature and glucose changes, Dr. Fabian Ngido and Dr. Martha Mkonyi. So Dr. Fabian Ngido is from US, Dr. Martha Mkonyi is from Tanzania, Muhimbili there. So they provide those education. June 9th, we did a ventilation demonstration and skills. Dr. Fabian Ngido and Ms. Emily, sorry, that's a typo, Emily Rosenberg. And so they provide, both of them are from US, provide that demonstration. June 30th, we did fetal monitoring. So Dr. Emma Wakuru from US, Professor Michelle Brown from US, and Mr. Jafari Utavi from Muhimbili, they provide those education. And then session 2 for fetal monitoring was provided again with Dr. Emma Wakuru from US, Michelle Brown from US, Mr. Jafari, and then Ms. Neema Mushi. Unfortunately, I think that day she was not able to come in because there was some training or emergency at the Buguruni Hospital. And then, of course, Dr. Benela and Dr. Aminata from Mwananyamala also, they came as a group to share that case study, fetal monitoring. So it was a very good training. July 21st, we did diabetic screening management during labor. Dr. Gian Guido from United Kingdom, Dr. Aminata from Mwananyamala, Mr. Jafari from Muhimbili, Ms. Neema Mush from Buguruni, Dr. Emma Muguri from US, Dr. Mugaro from Mwananyamala, all provided training to try and identify pregnant women who are experiencing diabetes during the pregnancy and labor, and what type of medication you need to do. July 28th, we did the postpartum hemorrhage. That was the first session, identification and screening of, and then we went through the, like Mark drill, how to run the patient through from admission to postpartum hemorrhage event. Dr. Emma Wakuri from US, Ms. Neema Mush from Buguruni, Mr. Kamana from Muhimbili, Dr. Mlungu from Muhimbili, that's anesthesiologist, because he was explaining the side of postpartum hemorrhage emergency and how they do massive transfusion, like if the patient bleeding too much, so what do we do? And Dr. Gwen Randall from US, and Dr. Nestori Qhsc from Sweden, also they all provided some information about those case study we did. August 4th, we did Help Baby Breathe Essential Care, Dr. Fabian Guido and Dr. Lilian Msambichaka. They also gave like the synopsis of how it's going to be done in Tanzania, so the training, and so everybody knows, and that training also has been shared to all the prospectives. So if Ms. Priscilla can help us to talk to people in Tanzania to try and encourage them that they need to encourage people, whoever is coming, have those 2 training sessions for Help Baby Breathe and postpartum hemorrhage. And then on the 22nd, we had wound care and management. Ms. Victoria Jones from the US was able to provide that education because she's going to be able to see some of the patients at Muhimbili, and she's working with Dr. Mrema, from a surgeon from Muhimbili also, talking about the wound care and management. August 25th, we did another postpartum hemorrhage second session. It was just discussing how we're going to do the training in 2 weeks, less than 2 weeks. And then also we discussed the use of NASG, the pneumatic anti-shock garment. And then also, that's the one also Mr. Kodem provided how to do the sterile processing of that garments. And then, so we're seeing communication, how to use those garments and how to process it, and then make sure the process from one hospital to another is taken care of. So when they bring the patient on those machine garments, then we know how they're going to receive a clean one for the next patient. And then, so there's a potential of one training just for facilitators for postpartum hemorrhage on the September 5th. That's just a dry run to make sure everybody knows what they need to do, because there's 3 sessions in there within the postpartum hemorrhage, like just the content, the scenario, and then the use of NSG. So all those things are in place, but we want to make sure we talk to all the facilitators to make sure we are in the same boat. And then, so the last thing on that schedule is the September 12th, that's the leadership and administrative. So we want to make sure all the administrators who have been involved with all this training, we need to make sure we meet that day and then discuss and finishing up last minute things, is to make sure when we start the next day, it's training. I mean, there's no time to spend anything else other than just starting the training at 8 o'clock. So that's what we have been doing, Ms. Priscilla. And if you have any question, just let me know, or otherwise I can continue doing whatever we need to do afterwards. Any question, Ms. Priscilla?
I'm okay. So
Okay.
you can continue. Yeah.
Okay, thank you. So from the last meeting when we did the August 19, there was a number of items that people need to cover. And then so there's a lot of stuff that have been completed already. So which some of them I'm going to put on the current agenda just for the review purposes, but the rest has been met, like all the invitation letters from each hospitals have been received. So we are ready to go that part. So that item has been off the schedule now. So also the emphasis should be again now for every single person who is showing up for training. We want them to get those training from Help Baby Breathe. I believe there are 4 sessions, and then help postpartum hemorrhage. Those are 3 sessions. And the link has been shared, and I'm going to send again to you, Ms. Prisa, just so you have, if you can share with the other administrative people who are in charge of those areas that you are assigning people, so at least they can review. Majority of the training, at least like 1 hour to 1 hour and a half. One of the training, which was the longest, I believe, was the baby basic fetal monitoring, but it's not on the ones that we need to review. So, but those ones are going to be shared in the YouTube, and people who wants to come and view those, they can view on their own leisure time. But we want specifically for these 2 areas, people need to review those content before we get there. The sterilization, the update, I was just saying, Mr. Nicodemus, have already shared those templates and the steps, how we need to do. We're going to try to make a little badge, but it's like just a little card. So people who are there, we can give them just so they know. When you put the patient in there, how do you secure the garments, and then how do you prepare that garment for being washed or cleaned up? Things that you need to do. If there's any blood clots, we know more like the patient is bleeding. That's why she's on that garment. So how to take those stuff out before you soak it and be ready for preparation. And then so we need to still continue working with Amana Hospital. Whatever the process that Mwimbi is going to be doing for sterilization, then Amana also needs to have an idea to make sure those things are in place. So at least when we transfer a patient from Buguruni to Amana, and then the patient that are being seen there, so they know how to clean that garment next for a next patient. And then of course, we're going to try and make sure the Buguruni also have that process in place, just in case if they use for a patient over there without transferring, and then maybe the patient has to be get better, so they didn't transfer them. They still need to know how to take care of those garments, because that garment needs to be waiting for the second part. But all those things are being behind the scene, and Dr. Sangalala from Amana has been coming to the meetings, and she's aware of that. So she's going to continue working behind the scene. If there's any issues, we're going to have to try and address those things. So that process should be ongoing. And then so for today, that's what we have final schedule. So I know Ms. Priscilla has been working. She just came on board last week. So I'm sure there's a lot of things that she's working behind the scene. And if you have any updates, anything that we need to be aware of, Ms. Priscilla, that would be great. Ms. Priscilla?
Hey, yeah, I guess everything is all right. And because this was my first time, so even the outline itself, it can lead me. So far, everything is on board. And as you said prior, we are just waiting for the listing of the participants. So I guess after this meeting, I'll be able to share with you all the names who are expecting to attend the training. Okay,
perfect. And then so just, yeah, so I will give you more information also, just the background. So when they give you the list, so at least you are more aware of like exactly it's going to be run at those few days. I know Dr. Martha Mkonye and Dr. Robert Tillia, they spoke about using for train of the trainers. And then so that's the part to which it was an added group of people. So these are the ones that when we leave after the training, they will continue teaching everybody else. That was the request for the Minister of Health to try and teach as many people as they can. And then so we're still waiting for them. I know Dr. Martha Mkonye last night texted me saying they're still working on it, and she will update as soon as she can to know how many the trainer are going to be. So I'm going to move to the next session, which is going to include all of them, and then I'm going to come out of this sharing. So quickly for the dry run what we are trying to make sure when I come to talk about the people who are going to be there is going to give you more information. So the background is we're going to have 8 sessions, morning and evening, afternoon, and then we're going to have like a pre-training video survey to ask a few questions to the people. We are still working on either have a paper little questionnaire or have an online. And I was talking to a couple of people in Muimbili. They were saying if we can have the Google Doc, those 5-6 questions, then the people will come, and the ones who have smartphone, they can have the link and fill out that way. And then the people who don't have the smartphone at that moment, then we can have your paper. So we're still working on it. By the time we get there, we know for sure which way is going to be a secure way. But we always go for plan B. We keep papers with us to make sure people who are coming into the training, at least they answer those questions, just to get those the background of the attendees, to know how many doctors, how many nurses were able to come in. Because yes, we can have the list and people are assigned to those areas, but at the end, we need to know who actually was there, how many times, how many years they've been working, and did the people working the night before, like to try and find out how alert the participants are. So that's just a little background of it. We're going to gather that information. At the end of all this training, we need to give you reports to the management to tell them, okay, how many people came and this type of the attendees, and then how many were able to either successfully finish that or not. And if there's the training needed further, then the trainer will help us with that. And then registration, of course, so that some people who are non-healthcare workers who are going to be involved with the registration to make sure whoever is coming is supposed to be coming, and they're going to go to this station. So we have to have all those extra peoples. And then certificate of attendance. So people who are going to attend the training, we're going to be identify them. Yes, they're scheduled, maybe 6 or 8 on that station. If maybe all of them show up, that's great. So we mark them, and then at the end of the day, we were thinking of giving them electronic certificate of attendance. We're still working on it. So as soon as we get those things, when we get to Dar es Salaam, then we'll be able to offer that as soon as they finish their training. And then, of course, evaluation. So we're still working on figure out how to have post assessment of their knowledge acquisition. So, but we update before we get there, so we know for sure what type of assessment will be done. And then, so that is the part. I'm going to come off the share screen so we can have a little discussion about the schedule. So the schedule, for example, on those Tuesday up to Friday, it's going to be, as I said, the 8 session. So the first session is going to start Tuesday morning from 8 to 12. So those are 4 hours block. So if somebody is attending, needs to attend those 4 hours. And then, so we start with the 2 hours is Help Baby Breathe, the first session. And those Help Baby Breathe, we have 10 stations for each group. So if we are hoping to get those 400 people, divide by 8 sessions, that means each session, and we need 50 people. If there's more than 400, then we can add that way. And then, so when we have 50 people, we're going to divide them in 10 stations. So each station, within a session, we have 5 people. So for the Help Baby Breathe, at least the bare minimum 5, at least the maximum probably 6 or 7. We don't want to have too many people, because we want to make sure every single person touch that, the ventilation, and demonstrate their skills. Having too many people, then we're not going to have enough time to do the assessment and verification. So that's for the Help Baby Breathe. And as I said, the training is 2 hours. So most of the time we aim to finish like an hour and 50, whatever, 55. So 5 minutes, people can switch from one area to the next session. And then, so for the postpartum hemorrhage, it's going to be the second 2 hours of those 4-hour session. The same thing. Whatever the number that is being assigned, so we divide in 10 stations, and then if it's every attendee is will get a chance to get the scenario, review, and then practice, and then demonstrate, and then do the application of the NASG. So that's how it is. So when you're doing the schedule, we need either 50 for that session, and then on the 50 that session, when I get those names, then we divide them in each 10 station, and then we assign those names in each 10 station. So when they register, it's going to say maybe Harriet is coming at the Help Baby Breathe session 1, Tuesday morning, 8 to 12. And then I'm going to be at Help Baby Breathe, I'm going to be at station 5. And then my facilitator is going to be Dr. Ngido. I mean, I'm just giving an example. So that's how detailed the patients, I mean, the student, the attendees will know, I'm going here, I'm going to be in this table, I'm going to be in this section. So it's going to avoid the confusion and start signing up. Okay, first five people go here, five. No, it's not going to work. We want to make sure everybody's distributed. And if we know ahead of time, definitely we want to know one doctor, registrar, or whatever, and then with the nurses. So each station should have at least one doctor. If we have enough of them to each station, that will help in learning purposes. Because if the doctor have to take their role, the nurses have to take their role, or the midwife have to take the role. So we have to make sure no one all the station is nurses. And we don't want all the station to have all the doctors because they're going to work with nurses. So that's why when we need to know ahead of time, the people who are coming, then we have to assign them to make sure each role is being covered during the practice. Especially, of course, for postpartum hemorrhage, we want to make sure we have a doctor. If we have anesthesia or an anesthetist, we want in each station, so to make sure if they have to do something, we need to know their role. If the doctors have to order something, they need to know their role. Midwife is there, need to know their role. So that's why we need those names ahead of time to divide them and distribute them in each station. And then, of course, lunchtime comes, and then the same thing continues again. Each session is going to be repetitive of what we've done. So people are only assigned for 4 hours block, and that's it. Once they finish those 4 hours, they go away. They don't come another times. Yes, Dr. Msambichaka.
I just have a clarifying question. Madam Priscilla, are you making the schedule for all the hospitals or just Muhimbili?
Yeah, the schedule is for nurses and midwives and anesthetists who are working here at Muhimbili National Hospital. But I heard that training will comprise the others from Mwananyamala and Buguruni. So I didn't receive yet their names, but I have for those who are working here. So I have a list, but I failed to put them in groups as because of the roster. So because the training will be on the 12th of September. So to put them in groups today, I won't be able to know that who was coming from the night shift or will come from the night shift, who will be on day off, so and forth. But the listing is already been prepared.
When do you know the schedule for September, the roster? When do you know the roster?
Because the rostering is after every week. So because we are still in August, late August, for me to know the exactly from the 12th, the end of the first week of September, that's I'll be able to know that, oh, who will be coming, either the first group or the last group. But for now, I have only the names. Yeah.
Do you know who the I guess the lead or the nurse directors are for Mwananyamala and Buguruni, so that you guys can work together? Or is Muhimbili going to send? I think it would be better if we had all three like directors from the different hospitals working together, so that when you do the schedule, you know, it's like, oh, I have 2 people and you have 1 person or whatever, so that we know exactly how many people. Is that possible to do?
Yeah, it's possible, and it will really help me because I was even failing, like I won't be able to have maybe the first group with maybe 10 nurses or midwives are coming from the same place, because they have to go to work, like I said before. Some will be on day shift or night shift. So if you have a mixture of people, that would be perfect. So maybe I'll try to look for them, and you can sit together maybe and arrange those sessions and groups who will participate at this group and so forth.
So what I'm gonna do, oh, sorry, go ahead, Mr. Mbichaka.
I was just gonna say, maybe Harriet, if you already have those people, maybe just like connect them so that they can talk together and make the schedule together. At least share names and assign one. If they want to assign one person to do the schedule, then everybody just feed to one person. Or if they want to work together, then they can work together.
Yes, that's what I was going to say. I do have Dr. Banera's information. I do have Dr. Kilowoko from Buguruni. Dr. Banera is from Mwananyama Dr. Kiwoko from Buguruni, and Dr. Sangarala from Amana. So I have those names. So I'm going to share with them because they are also, they know who is coming from their hospitals. So then you're right. They might say, okay, these people are going to come Tuesday, these people are going to come Wednesday. So it will be easier to distribute that part. So I will share those names with you. And then, so the four of you, we figure out who goes where. And then, yes, it makes sense to have, if we have, let's say 10 people from Buguruni. Yeah. So then also for us, we need to know. So we put them in different stations so they can learn with different group from different hospitals. Then yeah, I agree. I will do that when we finish the meeting. Yes.
Was there another hospital that might be sending trainees as well? I know you mentioned Amana.
I believe Temeke and another hospital. But they were, Dr. Mkonyi is the one who was helping, and Dr. Tiria. They're working on that part. So, because those are the trainer. Yes. So they're working with that part once they know the number of them. Because the 10 or 10 are not going to be with too many. It's just probably, I don't know, 10 or 15, which we can disperse them. I mean, they have their own training and then join us, join the regular training. So let's say when they train the trainer, we have the postpartum hemorrhage more content than anybody else. So that when the Help Baby Breathe session continues, the trainer is going to have something on the side, learning or theory or whatever. And then when it's time for postpartum hemorrhage session, they will come and join the first 2 days. And then when the Help Baby Breathe continues, the trainer continues for postpartum hemorrhage again. So on the day 3, which is Thursday, the trainer is going to join in the facilitation of the content. And then on Friday, the trainer people are going to be running, and then we are observing them. That's how you produce train the trainer, because they need to see, I mean, to get the content extra, they need to observe, they need to come and show it, and then you evaluate the last day. But those are the added, so they're not going to skew the number of attendees, because they are in the little group by themselves, and then they join in as extras. Any other questions? That's what I had from my agenda and for meeting, and I'm so happy that Madam Priscilla is here.
Yes. And Madam Priscilla, when you complete your acting directorship, you're invited to continue collaborating with Dr. Gaboni, Qhsc.
Yes, we'll find her wherever she is.
Sure, I will.
No, thank you very much. Dr. Msambichaka?
Oh, I was just going to suggest that don't forget anesthesia. Give her the name for the.
Dr. Mlungu, yes. So Dr. Mlungu, I do have the names. I do have the names for anesthesia. Dr. Mlungu gave me the anesthesia attendees, and then the 3 anesthesia who are going to be teaching with us. So yes, I will share both. I mean, all of that list. Yes.
Okay. I guess it's just figuring out what their schedule looks like that week to figure out when they'll actually be able to attend.
For the anesthesia?
Mm-hmm.
Yeah, so Dr. Mlungu already told me when they can come.
Oh, okay,
Yeah,
great.
Yeah,
anesthesia is all set.
Yeah, he's already spread them out. Yeah, he's very good. He already spread them out, and that's why he gave us those 3 to continue being more, participate on the training, so then they can come and continue teaching the rest of the team. But he wanted the attendees to participate in each station. Mm-hmm. Okay,
all right. That's all I had.
Dr. Angido, any?
No, I agree with Dr. Msambichaka's that we needed to know the names of the people who will be coming. I talked with Msambichaka last week, and we're probably going to have at least, I mean, we already know the providers are coming from US, and if we have the names from Tanzania, then we can divide in our session, and then Madam Priscilla will just have to add all those attendees. So if it's like Msambichaka or this day, she'll be in this table. So we just needed to know who are the people who are going to be working with her that day. So whenever they know their schedule for the month of September. And then between us also we'll decide about the lead facilitator and then try to rotate like that And then some will be like in individual tables.
Yes, so even Maricela and Bree were working on that Excel spreadsheet, and then we do have the names, I mean, submitted before, but we don't know which day they can come in. So definitely when we get the list from Madam Priscilla, that will help, as what Dr. Fabian Ngido is saying. And then we have, like, yeah, as you say, Dr. Fabian and Dr. Msambichaka, the lead for Help Baby Breathe, and then all the other people are in there. But yes, definitely Dr. Ngido and Dr. Msambichaka, you will get that and then inject for who is the facilitator. So we have, because we have that, we need that list for the registrars. So the person who is coming, okay, come in, what's your name? We find the name here, you're going to table 10, because you need other people to come and help you guys. So you don't have to start searching for people. That's why we need non-healthcare workers to come and help us with the registration. But that schedule has to be done way before that, because we need to know each table, how many people are going to be there. So when we are setting up the stuff, this is 6 people, this is 5 people, we know, sure, we have all the devices they needed for training. Dr. Gwen and Dr. Arena, any comment, questions? Thank you for coming.
No, I think you really, we have to have a schedule, and
Yes.
working schedule, that's the only thing that's, it's important. And it's also very important to make sure that we have interdisciplinary groups.
Yes, for each station, great. Yeah. So Dr. Gwen is coming with us. Is one of the CNAs. So she's coming to help train the postpartum hemorrhage and lead person for the train the trainer for postpartum hemorrhage. And then Dr. Rina, you want to say hi? Something?
Hi, everyone. No, I agree with Lillian. I agree that it would be useful to have names, but no other comments.
Thank you. So Dr. Rina also is going to be helping with Help Baby Breathe. So be one of the facilitators. Yeah.
I had my hand up. Yeah, I was going to mention, I know it was on the agenda. We talked about the dry runs with the NASG.
Mm-hmm.
I'm not sure if everybody's familiar with what that is, or remember we.
Oh. Yeah, so I mean, the NSG is part of the training for the postpartum hemorrhage. That's the gamut. It helps stabilize the patient during the transfer from one low acute area to high acute area, just to make sure they don't get into shock. So we, if the patient is bleeding from one, thank you, Dr. Ngido. If the patient is bleeding from, let's say from Buguruni and needs to be transferred to Amana, so then yes, they will be placed on that gamut and then transfer that patient over there. Once they get there, then the Amana take care of that patient. The same thing if that person happened from Mwananyamala going to Muhimbili, same thing could happen there, or from Amana going to Muhimbili. And that's why we're talking about sterile processing, because those gametes have to be clean as soon as the patient has been removed, because if it stays that long without being processed, the blood and all this content is going to be there to the material, and then after a while the microorganisms start growing and it's going to become an infectious area. So that's why there's a specific process that Mr. Nicodem was able to provide training on Thursday, and everybody knows, we should know how to process those things. And then so if one hospital is using that NASG, they need to know how to place it in the location that is more accessible when it's needed. And then so one discussion was like, should we put it in hemorrhage cut? But we don't have the hemorrhage cut for Tanzania. So anywhere that we put those postpartum hemorrhage devices or equipments to ready for the next patient, so then probably we should be putting that. But so that's the discussion is still ongoing, and then more like it's going to be cemented after the training, so everybody knows what exactly to put it. Any other questions? I see that Dr. Msambichaka, yes. She has to go somewhere. She's been called.
Yeah, she's gone. So
yeah. Any other questions? As I said, we're going to probably have another meeting. We're just figuring out when. Should we have another meeting for the last one before we get there? But communication is continuing on the side. So anybody has any issues please let us know so we can continue discussing. And if there's any need, we update probably within 3 or 4 days to see if the next meeting should be there. More like it's going to be either Thursday or Friday morning to try and see if we can catch up and see if there's something that we need to do before we come. We definitely want to do that. Madam Priscilla, anything? Oh, you're muted.
Yeah, no, I don't have anything for now.
Okay, so what I will do, I will send you the contact information from Wananyamala, Buguni, and Amana. So then we, because I know they did share the schedule, they give Mr. Jafari the schedule, but it'd be good for you to have that too. And then so you will know, and then we can distribute at least they share. If Wananyamala, for example, I think Wananyamala was sending about 93 or 95. Buguruni was sending, I believe, 35. I don't have a number from Amana. Dr. Stangalala was working on that part. So then at least we can distribute it. Then so they share like one table. I mean, one station should have like a Muhimbili, Wananyamala, and maybe one over Buguruni. Amana, if there's more than probably 30, then we can still have maybe 2 or 3 stations have distributed in. I mean, people are distributed in each station, just so they can learn with their peers from different places and see what they do. And then usually that helps you in learning purposes, yeah. Oh, the Dr. Map side is there, one of the anesthesiologists. Then we can make sure the schedule is done, and then we can distribute and make sure it's effective. Everybody's schedule where they're supposed to be. And I think that's what I have. Dr. Map, I know you came in a few minutes late. Any questions about the schedule? We're talking about the schedule. Anything about from anesthesia? Dr. Said?
Hello.
Hi.
Hi, good afternoon.
Good afternoon.
Good morning.
This took a good morning, Bado.
Okay, sorry I'm late. I'm at work.
That's okay.
Okay, so yes.
No, go ahead.
What was the discussion?
No, we're discussing about the scheduling, and then so Dr. Mlungu did give me the names of you guys, the 3 facilitators and the 10 attendees. And then so we want to make sure the attendees, the people who are coming to learn, for those 10 people, we put them in the different, even if they show up in one station, we put them in the different stations. So each station we have different disciplines, just to make sure if you have a doctor or a BGYN, or you have a midwife, or you have a nurse and you have anesthesia there. So everybody, we have different roles, and that's how it's going to facilitate the effective learning. So since we have 10 of the from the anesthesia department, so then we just distribute you from each station. That's what we were discussing before you came in, yeah.
Okay, so we will have 10 stations?
Yes, for each session, we have 10 stations, yes. And then so the 3 of you, yeah, you and I think it's Senior Susan, I think.
Sister Susan and Dr. Meza.
Meza, so you'll be on the facilitators on the side, so you have your own station to facilitate. So in each station, we have 6 to 8 people. It depends on how many we're going to have the attendees. Bare minimum is going to be probably 5 or 6, but maximum we don't want to go above 8, because we want to make sure everybody who is there are able to touch that.
To participate physically.
Exactly. Yes. Yes.
Okay.
Yeah.
But I think that will be good.
Yeah.
Okay. So is Dr. Mulungu in?
No, not today. He said he was not going to be there. Yeah, but he gave me the names probably last week or 2 weeks ago. Yeah.
Okay, because it will be much easier if we know all of this, so we could prepare ourselves from the timetable, rosters for those people.
Yes. When we finish the meeting and then the video is ready, then yeah, I usually forward it to everybody, including him. Yes, so he will be aware of this.
Okay, no problem.
Okay. So and that's it. I think we have already covered what we needed to do, and the schedules. So it's only 11 days to go. So I'm going to let you guys go and we meet again next week.
Okay, no problem.
Thank you, guys.
Okay.
Thank you.
Bye. Cousin Jim.
Bye. Bye-bye. Thank
Yeah.
you.
Yeah, you're welcome. Thank you, Madam Priscilla. Yeah, that was great. Nimefurahi sana kwamba umekuja.
Asante.
Yeah, sawa, tuendelea kuwasiliana basi zaidi.
Yeah, sawa.
Okay, asante.